Good afternoon to you, St. Vincent and the Grenadines. Once again, in studio, we've got Dr. Rosmond Adams, Director of PANCAP, Pan-Caribbean Partnership Against HIV and AIDS. Good afternoon to you, Dr. Adams, and welcome to the studios right here at Star FM.
Good afternoon, Monique, and good afternoon to everyone listening in St. Vincent and the Grenadines and outside of SVG. Thanks for having me on this afternoon.
It's so much a wonderful pleasure in doing so. Dr. Rosmond Adams, how are you feeling?
I'm feeling great. It's good to be at home. It's good to be in St. Vincent and the Grenadines, and also it's always a pleasure to be here on radio speaking on health-related issues.
So good. And I know you've been away for a while, especially after taking up duties sometime in this year. And your location is now in Guyana with the borders being closed. I know how it is with your mind at home and where you're at. And, your mind have to be so active in getting, all the strategic planning on board, especially with this devil, COVID, which came from nowhere and just have that toll on the world. All right. Now, I will allow you to let the folks know exactly, the field in you're really responsible, the field you're responsible for right now with your new position.
Great, thanks. Well, I'm no stranger to the health field. As you would know, many people in St. Vincent will know me from the working in non-communicable diseases and then in communicable diseases in epidemiology. I'm now currently the director of PANCAP, the Pan-Caribbean Partnership Against HIV and AIDS. PANCAP is a partnership with government, National AIDS Program, civil society, and other key partners. And what we do is that we work with an aim to have an AIDS-free Caribbean and to reduce new infections of HIV in the Caribbean. So my work is principally focused on HIV, AIDS, and sexual and reproductive health rights in the Caribbean region.
Okay. And, COVID-19 has really, really did it. As I said, we all are just trying to get accustomed to the new normal, as we would say. As we all know, COVID had added, and it had, things definitely have taken away from, or especially, the daily life. Living HIV and AIDS, all right, which is, everyone is talking about it and knowing, the risk, especially with COVID-19 here. Are people HIV at higher risk for COVID-19 than other people?
Right, a very good question. And I think that this is one of the first questions when COVID-19 came about 6 or so months ago. In terms of who would be at higher risk of getting COVID-19, but not only getting COVID-19, but also succumbing to COVID-19. As you know, that COVID-19 is a new disease. Where it has come around about 6 or so months back, and we're still learning a lot about the disease. But the evidence that we have so far have shown that that there are no added risk of getting COVID-19 nor dying from COVID-19 if one is HIV positive. However, if one is HIV positive and they are not taking their medication as prescribed, or they have a low CD4 count, which means that the CD4 are the cells that are responsible for defense mechanism of the body and ensuring that the body can fight against diseases, then they may be at an additional risk of contracting and maybe having a more harmful effect from COVID-19. But as the evidence show so far that if you have HIV, you're at no greater risk of getting COVID-19 nor suffering from COVID-19.
Okay. But what can people with HIV do to protect themselves from COVID-19?
Right. So, like everyone else, people with HIV are required to adhere to the national guidelines that are put out, and these include social distancing. So people are advised to keep your distance, because we know that COVID-19 is spread via respiratory droplets, and therefore social distancing or physical distancing is one of the measures. The second is the wearing of a face mask. As we know, face masks have been proven to reduce the transmission of COVID-19. And so if whether you have HIV or not, it is advisable to wear face masks, especially when you are in a group and you're in close proximity and where social distancing may not allow. The taking of your medication is so important. People who have HIV are generally on medication, and therefore it is important that they continue to take their medication as prescribed. To follow up with their physicians, because when you have HIV and other diseases, the regular checkup is needed. And so we know with COVID-19, there have been a number of disruptions where places have been closed. There have been disruptions to services. And so if you do have HIV, you need to check in with your physician to find out, how can you get your prescription refilled, how can you get your regular blood test done, and so forth. And finally, just like everyone else, it is important that you stay healthy, that you eat healthy, that you do physical exercise, and you ensure that you avoid stress and you have adequate rest. So the measures for HIV are basically the same for anyone, for you and I, and anyone who may have other diseases or who may not have any types of diseases, to ensure that we practice social distancing, wear face masks, and ensure that we stay healthy.
And will you say that what else can people with HIV who are at higher risk of getting very sick from COVID-19 do to protect themselves?
Well, I would not say that people with HIV are at higher risk, but then you may have HIV and you may have additional risk factors, or what we call comorbidities. So you may have HIV and be diabetic, or have heart condition, or other health issues. And so in order to protect yourself, it is very important that you avoid going to areas where there may be high level of COVID-19. You also ensure that you follow up with your physicians, and you take your medication as prescribed, and you eat right, ensure that you get adequate sleep, ensure that you're exercising as usual. So if you have HIV and you have comorbidities, it is very important that you monitor your well-being and stay away. Ensure that you're adhering to physical distancing, and you're wearing your face mask, and you adhere to taking your medication. I think that is so important and so critical, that you monitor your health status, and you check in with your physician. You may not be able to travel because of restrictions and so forth, but you need to check in virtually. There are a number of platforms that are available, whether it is through WhatsApp, whether it is through the internet. A number of sites are coming up where you're able to communicate with your healthcare provider, with your doctor, with the nurses. Use these mediums. I don't think that you're left alone or you're isolated. Use these digital new mediums that have come up to ensure that you stay in touch. That is so critical, that you stay in touch with your healthcare provider, and they will advise you in terms of what next to do.
All right. And my next question would have been if, with people with HIV, if it's a good thing that they travel around this time.
Well, around this time, only essential travel is advisable. So whether or not you have HIV, it is advised that only essential travel is recommended. The normal casual travelers that we do, where we pick up and leave and go all around the place, that is really not advisable around this time. If you have to travel because of an essential reason, it is recommended that you find out what is the current COVID-19 status in the country where you're going to, what are the regulations in the country that you're going to, and that you adhere to all of these measures. Ensure that you can you can social distance. If that is not possible, the wearing of the mask at all times is recommended, and that you also have contact numbers of healthcare providers in the event that you get sick, that you're able to to reach someone and find out what next to do.
Okay, wonderful. Well, when we had recorded our first case sometime in March, everyone wanted to know who that person was. Where is that person living? Why you don't want to make mention of that person's name? All right. And you know what that could have done, right, to that person. What can everyone do to minimize the stigma about COVID-19?
Great, good question. Stigma around diseases is not anything new. Even HIV, we have been faced with stigma and discrimination for a number of years, and we who work in the field of HIV and AIDS realize that stigma and discrimination does not make anything better, it makes it worse. And so with COVID-19 and other diseases, even diabetes and common diseases that we know, there is stigma associated with these diseases. People are stigmatized, places are stigmatized, and things are stigmatized. And so with a new disease, we expect that there will be some level of stigma discrimination. What we have to do in order to fight against the stigma and discrimination is to be very careful with the information that we put out there. Accurate and timely information is so key. We're not saying that you have to put out information there on the name of the person, where the person is living, the age of the person, etc. But you need to be forthright with the information, and the information must be adequate, it must be accurate, and it must be timely. Mass communication campaigns have been proven to work in HIV/AIDS. We know that there have been over the years a number of mass communications campaigns addressing all of the issues around HIV and AIDS, and so COVID-19 can adopt these same type of measures to avoid stigma around the disease. There is a need to build trust with the communities, and so healthcare providers have to build trust with the community so that the community understand and know the disease and know how to treat someone who have been diagnosed and living in the community, because people do and obviously will have fear, and then will need to know, how do I handle someone even at home, in my home,
Right,
who may have been diagnosed with COVID-19? How do I deal with someone in my community who may have been diagnosed with COVID-19? Because one of the concerns is always, is the person safe to go back into the community and interact with me? When is the person free from the virus, and so forth? So this information is very critical to let the community know that after a certain time, this person is safe, you can interact with them, and so there is no need to run from them. There is no need to have that level of stigma against persons who may have been affected. There is also the need to communicate with empathy to persons who have contracted COVID-19. But also important is that we provide support mechanism to answer questions and concerns that persons may have, because there are lots of myths and information all around the place.
true.
And so you need to ensure that the source of the information that is being used is one that is verified. And so if you have questions and concerns, that you can go to one source and ask that question, and they're able to answer it for you, so that you don't have 20 or 30 versions of answers around the place. Because with all of that, it creates all of these gossips and misinformation that you have to deal with. So information management is so important when we're looking at stigma and discrimination, and really going down to the community level and have the people of the community understanding the disease and what they have to do in order to support persons from the community who may have suffered and who have recovered from COVID-19.
Wow. Okay, great information there. And that was on HIV and AIDS, having to deal with COVID-19. Okay, gender-based violence. All right. I could recall around May in June, May, June, around there, I saw an article it was from Ghana, where the president, the ladies storm out and to protest and were demanding the president to lift the ban because they just couldn't deal with the demanding, and it probably was too much for them, right? And there was another article where a mother actually seeking advice as to how she should handle her own situation in her home, where she had to leave the home and having the eldest, child looking after the other siblings. And only to find out that the 16-year-old was, the eldest one, which was a male, that was the one that was taking care of the rest of the siblings. And there was a 16-year-old girl and the 13-year-old, they both got pregnant by the brother. And she was seeking advice and wanting to know, I mean, come on, what has this thing done? And you could hear the cries from the different homes. I've never heard it here in St. Vincent and the Grenadines or, anywhere in the region. All right. Now, my question to you on COVID-19 and gender-based violence. Home. Because it happens in the home. Home is not a safe place for me. What can I do?
Great. The issue of gender-based violence is one that is so real that many people can identify with it. Gender-based violence is a cause and it is a consequence of HIV. With the COVID-19 measures, as you have indicated, such as stay-at-home orders, the lockdowns, the curfew, and so forth, it puts people in a confined environment, and being in that confined environment in which we are not accustomed to can cause issues such as, gender-based violence, intimate partner violence, sexual abuse, and so forth. The overall statement that home is not a safe place may not be correct. It depends on the home, because for some the home may be a safe place. Right. But I understand where the statement is coming from, because for some, being confined at home will mean that they're being subjected to more intimate partner violence. They're subjected to abuse and so forth. And when we speak about gender-based violence, what I want us to do is to deviate from the status quo, because we always think that gender-based violence is a man beating a woman, but then there are cases of where the woman can beat the man, and that is why we it's gender-based violence. And you also drew example of minors also being part of these as examples of gender-based violence. So gender-based violence is any type of violence that is perpetrated against, whether it's male, female, male, female, and so forth. And it is very important that we address the issues of gender-based violence, because, as I said earlier, it is a cause of HIV, because as you highlighted in one of your example, it can cause forced sexual encounters, and forced sexual encounters are often unprotected sexual encounters, and you do not know what the person may have, and this can then cause HIV and other STI. But it is also a consequence of HIV, because if you have HIV and there are issues such as not disclosing, and your partner or someone else finds out, then it becomes and you're hiding, it becomes a confrontational issue, and then there is that issue of of aggressiveness and fighting and so forth. If you recognize that your home is not a safe place to be in, it is very important that you know that you tell someone this, that you also look for ways in which you can communicate and look for referral mechanisms so that you can get that support. It may not be easy, because when one is suffering from gender-based violence, it is not the easiest thing to speak about, because there is so much taboo around gender-based violence that maybe the person don't want to let anyone know that they're getting abused and so forth, and they suck it up, as we will say in our cultural context. But that is very, can only last for a period of time, because after a while you're going to explode. So it's very important that if you're suffering from gender-based, from abuse, from violence, and so forth, that you look and you find ways of coping, whether it is through an organization that exists that can lend support, whether it is through the church, whether it is just talking to a friend, and you don't have to have that personal face-to-face, contact if you want to reach out to someone. You can possibly use the internet, WhatsApp a friend, and let them know that you're going through this and you're subject to gender-based violence, and look for mechanisms to help you to be able to respond to it, because the last thing that you want to do is to really stay at home and be the subject of aggression, violence, and so forth.
If you had to tell the president will you tell the president to lift the ban?
The thing is, with COVID-19, these measures were implemented solely because of trying to reduce new infections. Mm-hmm. And so when public health measures are put in place, they only looked at one dimension, that was to reduce new infections,
right,
without looking at what can these measures, what are the implications of these measures. And there are many implications other than just gender-based violence. Yes. There are implications where these measures have been put in place, and these measures have people have lost their jobs, people are unable to move around, and so forth. And therefore, the advice will be not to lift the ban, because you still want to be able to control the spread of the disease.
Right.
But at the same time, you want to ensure that the people who are impacted by these issues, such as gender-based violence, like sex workers and other people, that the policymakers can take into consideration their views and find ways of supporting them while these measures are implemented.
Yeah, really, 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 really unfortunate. And with the mom with the siblings there, what advice you would give to her, knowing that it's an unfortunate situation, what advice you would say to her?
The thing is that you have to seek professional advice, and so you will have to go through the legal and the health related processes, and be able to seek the advice, and then they will direct you accordingly. But then it is never that you can respond by yourself and do what you think is right, but to ensure that you consult with the authorities, and they're able to support you and guide you along the way. And there are many support systems in place for people who are suffering from gender-based violence, intimate partner violence, etc., sexual abuse, where you can discreetly, with confidence, reach out to them, and they're able to support you and to tell you what you should do, and so forth. But I also want to mention something, that a lot of times when we speak about gender-based violence, we're looking only at the victims.
Right.
We have to also look at the perpetrators of these crimes and of these activities, because they themselves have issues that must be addressed, and the root cause of these issues must be addressed. And so if we don't look at the perpetrators and we're only looking at the victims, they will then continue to do these types of aggression on others, because once your victim is removed, then someone else move into that scenario, and they will then again become the victims. So then the perpetrators may have underlying conditions that we need to address, and so they themselves will require psychosocial and mental health counseling and support if needed.
Okay. I always like to put myself in the picture. All right. I need medical attention because of violence. Who can help me, and where should I go?
Great. So the first thing is always to reach out to your healthcare providers. And let them know exactly what is happening, and they will be able to help you if they can, or to direct you to where you should get that type of help from. Like I've said before, when we're looking at issues such as gender-based violence, it is always good for you to have someone close that you can confide in and that you could share information with, so that they're able to speak on your behalf if you're afraid. Because a lot of times when we speak about gender-based violence, there is the whole issue of fear, being afraid to talk, being afraid that your information may get out there, the issue of confidentiality, confidentiality. And so once you could find this one person that you can share information with and let them know what is going on, they may be able to help you and to direct you to health related care that you may need.
Okay. I am sure, but I am suffering, from mental problems because of violence. Is there anyone who can help me during COVID-19?
So during COVID-19, there are a lot of resources that are available. Online, you can go and empower yourself with all of the information that are available there. But again, ensure that the information and the sites that you are going to are validated sites, because anyone can put information on COVID-19. So ensure that the sites are validated sites that you're getting that information from. Many countries have put in place hotlines, so you can call these hotlines and you can get the COVID-19 information. And also, again, like I said, there are your healthcare provider is the best person to offer you, help and information on COVID-19.
Right. I am worried, always worried since this COVID-19 about someone I know. All right. How can I be of help to that person or persons?
The first thing is to reach out to that person. So if obviously you're worried about someone that reach out to them and find out if they're okay. Share correct information with them, how they can protect themselves. And we know that it's COVID-19 and you may have, you may not want to go and visit because of the whole of social, you may want to keep your distance. But again, like I've said earlier, you can use WhatsApp, you can use, social media, and you can keep in touch with them, check in with them regularly, find out how they're doing, encourage them to exercise, encourage them to eat properly, and if they're on medication for whatever disease, encourage them to take their medication and continue to offer that support to them, because I think that we all need that level of support, because with COVID-19 there can be a lot of stress, there can be a lot of issues, so that is very important.
Yeah, gender violence comes in different form, but who will you say is most at risk of gender-based violence?
Well, the thing is, like I've said earlier, we have to move away from the status quo, and we always think that women are more at risk. In fact, the data does show that women are more at risk, women and children, and so we must ensure that we have protective mechanisms in place to protect our women and our children. But all of us, any one of us, can be a victim of gender-based violence, and so it is very important that we continue to speak about gender-based violence. These are issues that many times we don't like to confront and we don't like to speak about, but we must speak about these issues so that we're aware of them, and we're also aware of mechanisms, safe places, referral systems, so that people can know how where they can go if they're victims and get the support that is needed.
All right, great. Whole handful of information right there. As we're about to round it off, got my question for you. All right, my final question for you. COVID-19, COVID-19 is just a talk. It's just a talk. And as I said before, it's the new normal. We have to just get accustomed to the new things in place and try to forget about the old habits, as I would say. All right. How do you see the Caribbean and the COVID-19 in the next 2 to 3 years?
Whoa, that's a question. Well, as you know, we are just in the beginning phase of a new disease, of an outbreak of a pandemic. Many of the countries have started by 1 cases and have increased cases and so forth. With the absence of a vaccine and with the easing of measures such as the lockdowns and the curfews and so forth, we will continue to see cases of COVID-19 as people move. But I think that unless we get a vaccine and everyone is able to have access to the vaccine, we're going to continue to see cases in the region. Therefore, I think that my parting message will be that we continue to be very vigilant. We continue to ensure that we adhere to the measures, especially social distancing. We continue to wear our mask when we're in places where we cannot ensure sufficient social distancing, because as we know, there is the asymptomatic spread. You never know who has COVID-19 and who you may come in contact with, and so it is very important that these measures are adhered to. In terms of a prediction on where we are going to be in the next few years, it is very difficult to say at this time. We will have to look at the progress that has been made with respect to vaccines. There are a number of progress that have been made. A number of clinical trials are on the way, and so we're being very optimistic that hopefully by the end of this year or early next year there will be a vaccine available, and then maybe later in the year it may come our way, and we may have access to it. But barring all of this, I think that we have to ensure that we adhere to all of the measures that are currently in place. Do not be complacent. Continue to operate as if the person next to you has COVID-19. Keep your distance. Wear your mask. Wash your hands. And practice proper hygiene.
Right. I've been following Dr. Tedros with the media briefings and stuff like that. And I could see the stress. I could see it on his face, like, we're doing our best. We are just doing our best. And having, to be in such position, I could imagine the hectic, the workload on you, and, focusing on, yes, we must need to find solution. We need to come up with something, because remember, there is influenza. There is other diseases as well. You can't take your eyes off. All right. So the health officials here in St. Vincent and the Grenadines, Minister of Health, Prime Minister, and all the other health personnel, who really actually get, with their swift actions in making sure that we, deal with this thing. I want to give it up to them, including yourself as well, doing a great job. It's really a pleasure doing this with you, and just want to wish you the very best, and continuing your work and stuff like that. As I said before, no, you guys are probably, at the table and coming up with serious strategic planning, to try to fully control, because this is the aim, I'm sure, to get rid of this COVID-19, to control. We could say, you as a health personnel can say, we, will tried our best to get rid of this COVID-19. Rosmond, I want to thank you so much for dropping by and, letting us in on these information, very, very critical information. And I'm sure the public, have learned a lot. And, continue. I always follow your updates as well, and you continue to just share the updates so that folks will always get the legit information that they need to make them even more aware, are more self-conscious as to what is happening around them with COVID-19.
Thank you very much. And as you said in wrapping up, even though we're fighting against COVID-19, there are other diseases that are around, and that is why we continue to stress that HIV is not left on the back burner, because when COVID-19 will have gone, we will still have HIV with us, and so it is important that that we continue to have this the COVID-19 response, but we also respond to HIV and other diseases, because we will have to be living with these diseases, and therefore ensuring that we mount a successful response to COVID-19 will require just effort, just more than my effort. It's a collective effort where all of us have to do our part. So thank you very much again for having me today.
Okay, all the best, and good luck in the rest of all your work and everything else. All right, kiss my girls, some of my favorite girls, when you get home, and say hi to Betty.
Thank you.
All right, all the best. And there you have it, St. Vincent and the Grenadines. That was the interview with Dr. Rosmond Adams. And as I said before, earlier on, Dr. Rosmond Adams, the director, PANCAP, Pan Caribbean Partnership Against HIV and AIDS.